A very good afternoon, ladies and gentlemen. My name is Kaviarsan Jiwa and I am a foundation student at University Putra, Malaysia. Recently, I had the chance to read an interesting article by a researcher named Dr. Muaffa Hussein. In his article, Dr. Muaffa concluded that 65% of physicians use social media for professional purposes, while 60% of physicians actually favored interactions with patients through social media. On the other end of the spectrum, more than 40% of healthcare consumers utilize social media for their healthcare information needs. The primary reasons listed by patients for using social media include education, obtaining information, networking, research, support, goal setting, and tracking personal progress. So, in my presentation today, I am going to discuss the key advantages of using social media as a means of health communication to educate the public. Personally, I firmly believe that health communication via social media is highly effective and should be given the requisite attention and consideration by health practitioners worldwide. My presentation is divided into 3 key points. Firstly, I will explain how social media helps health practitioners to reach more patients. Next, I will detail how social media provides a support and feedback mechanism. Lastly, I will elaborate on how social media helps to coordinate public response during a crisis. Alright, now that we are properly introduced to our topic, let me begin with my first point for today, which is how social media helps health practitioners to reach more patients in dire need of medical care. The wide range of social media available today can provide a bridge of accessibility to groups who are unable to easily access health information via traditional methods, such as face-to-face medical consultations. This form of healthcare is particularly attractive to younger people, ethnic minorities, and families from lower socioeconomic groups. Health communication via social media also comes at a relatively low price, since most social media platforms are generally free. As a result, citizens in poor countries with limited resources can finally gain access to much needed medical attention. For example, according to worldatlas.com, the country of Zimbabwe only has 83 doctors per million citizens, while Liberia is even worse with only 14 doctors per million citizens. Additionally, social media allows information to be presented in modes other than text. This useful feature can help bring information regarding health hazards and safety measures to audiences with special needs. For example, YouTube and Facebook videos can be used to supplement or replace text and is particularly useful in low literacy areas. Old people and the illiterate in particular will have a much easier time comprehending and digesting complex medical information when they view these videos. To sum up this section, social media can help medical practitioners to reach more patients and is also able to increase medical literacy among the general public. Now let me move on to the next point in my presentation, which is social media provides a support and feedback mechanism for both patients and doctors. The rise of social media has helped many people to overcome the accessibility barrier, thus providing a pathway towards a more holistic form of healthcare. Presently, there are numerous social networking sites dedicated to facilitating real-time communication between patients and health professionals. For instance, with only a few clicks, patients can contact their doctors through WhatsApp or Facebook Messenger. This instant form of communication can aid patients who have misgivings about their medication, are facing aggravated symptoms of a disease, or would like to have an online consultation session. At the same time, social media also encourages medical collaboration and peer-to-peer conversations between medical practitioners. For instance, the website sermo.com allows medical practitioners worldwide to have professional conversations and collaborate with each other on challenging medical cases. Patients with long-term conditions such as cancer or depression can also connect with other patients that have similar conditions through online patient support groups. For example, Websites such as patientslikeme.com allow patients to share their lifestyles, experiences, coping mechanisms, and treatment methods with fellow patients. These online support groups are an integral part of their long-term medical care. In fact, according to an article published in the journal Surgery, researchers created a Facebook group for 350 liver transplant patients, caregivers, and healthcare providers. They reported that a full 95% of survey respondents said that joining the group had been positive for their care. These online support groups are also very important as they provide valuable peer, social, and emotional support for patients. Furthermore, social media can also be used as a feedback mechanism to collect data on patients' experiences and opinions, especially in regard to their physician's performance, the quality of the healthcare they received, and their overall satisfaction with the healthcare experience. These feedbacks can affect patients' future medical choices, thus prompting healthcare providers to give the best service within their capabilities. According to Demi and Cooper Advertising and DC Interactive Group, 41% of people said social media would affect their choice of specific doctor, hospital, or medical facility. Now that we are at the end of my second point, I would like to once again stress the importance of social media as a tool for support and feedback within the healthcare community. Ladies and gentlemen, I have reached my last point for my presentation today, which is social media helps to coordinate public response during a crisis. In the last 10 years, our world has experienced several pandemics, such as the Zika virus, the Ebola virus, and most recently, the COVID-19 virus. In our present technological era, one where there are currently more than 3.8 billion social media users, social media has become a necessary tool to track disease outbreak and circulate vital health information to the masses. Health organizations such as the World Health Organization as well as local government bodies have taken to social media platforms such as Twitter to regularly update the public on the current state of a crisis. For example, in the current COVID-19 pandemic, Malaysia's Ministry of Health releases daily updates on the number of COVID-19 patients and deaths through their official Twitter page. Additionally, social media can be used to disseminate personalized messages immediately, thus making outreach more effective. A key example of this would be the World Health Organization's initiative to share news updates regarding the COVID-19 pandemic via the WhatsApp messaging service. Unlike traditional mediums, social media provides real-time updates and prevents the spread of misinformation regarding a crisis. Once again, taking the COVID-19 pandemic as an example, in a recent interview, the Malaysian Health Prime Minister claimed that the COVID-19 virus could be killed by drinking warm water. However, this theory was quickly debunked by numerous health experts on social media, thus preventing the further spread of this misguided advice. Social media is also a life-changing tool during such crises since it can connect patients and healthcare providers in need with the resources that they require. During the COVID-19 crisis, many hospitals have reported a shortage of staff and equipment such as face masks and ventilators on social media. In response, numerous citizens and private companies, including Tesla's Elon Musk, have pledged to support these hospitals either through the donation of supplies or through volunteer work. During a crisis, aid workers usually coordinate with information technology experts to monitor social media posts in order to identify target areas for intervention efforts. This measure can prevent the wastage of precious resources and direct aid efforts to the areas that need them the most. Thus, it is not an exaggeration to claim that social media prevents the exacerbation of a crisis by promoting awareness and aiding in relief efforts. Before I end my presentation for today, allow me to briefly summarize my 3 points on why healthcare communication via social media is highly effective. Firstly, I explain how social media can help medical practitioners to reach and treat more patients, especially those who belong to underprivileged groups. Next, I talked about the importance of social media as a support and feedback mechanism to not only patients but doctors as well. Lastly, I discuss about the crucial functions of social media during a health crisis, especially when it comes to coordinating public response. Thus, as an aspiring doctor, I truly hope that the applications of social media within the healthcare industry can be expanded in the near future in order for health practitioners to be able to provide optimum care for their patients. Thank you.